Autonomic dysreflexia, how it's present. It's typically mostly unique for people with spinal cord injury. Majority of people with T6 and above level will experience these episodes of autonomic dysreflexia, sometimes multiple times per day. I also, as I mentioned, there are numerous reports of autonomic dysreflexia was documented in people with multiple sclerosis, where predominantly spinal cord was affected. This elevation of arterial blood pressure typically diagnosed when blood pressure increased by 20 millimeters systolic from baseline. You have to remember that arterial blood pressure baseline in a person with spinal cord injury could be lower than typically what expected with able-bodied individuals. It could result in serious complications such as hemorrhage. It can occur multiple times a day, and we need to act urgently. This is a very crucial aspect. And this is what we don't want to see. This is one of the cases reported by colleagues from Spain, where an individual with cervical spinal cord injury developed urinary tract infection. Urinary bladder was irritated. He developed massive episode of autonomic dysreflexia with significant elevation of arterial blood pressure. And in addition to his spinal cord injury, he sustained intracerebral hemorrhage, which is obviously unfortunate. But this is a reality. And again, important aspects to remember, we need to manage this elevated arterial blood pressure promptly. What are the typical symptoms of elevated arterial blood pressure in a person with spinal cord injury? Pounding headache. Many patients will report horrific headaches and never experienced this headache before. They will present with skin flushing above the level of injury, and skin below the level of injury will be pale because of vasoconstriction. They will also present with a profuse sweating above the level of injury, and also they complain of blurred vision, goosebumps, and sometimes nasal congestions. They also sometimes say, I'm anxious. But I also would like to mention to you that many of our patients will say, I never had episodes of autonomic dysreflexia. And we're talking about asymptomatic episodes of autonomic dysreflexia, which we only can diagnose by measuring regular arterial blood pressure. That's why be aware that some patients whose blood pressure will be going up to 200 millimeters of mercury sometimes will tell you, I'm fine, I never had this condition. What are the common causes of the episodes of autonomic dysreflexia? As already mentioned to you previously, blood irritation, bladder distension, bowel impaction, constipation, skin irritation. It could be skin lesions because of the cubitus ulcer, but it could also be lesion of the skin within the rectal area from the fissures. Sexual activity. Yes, unfortunately, one of the pleasurable part of our life in people with spinal cord injury could result in significant increased arterial blood pressure. And from my clinical practice, I know that some young men stated to me, I don't want to deal with this. It's too painful. And also, there are many other possible causes could result in autonomic dysreflexia. And what's interesting to mention, that sometimes people with spinal cord injury tell you, I like my autonomic dysreflexia because it's telling me something is wrong with my body. That's why it's a warning sign and signal for the people with spinal cord injury. I have to do something. I have to check how I'm sitting. I have to check my bladder. That's why there are negative and some positive aspects of autonomic dysreflexia. What to do when you diagnose episodes of autonomic dysreflexia? What actions we have to recommend or do? First of all, if person is in supine position, sit person up. By sitting person up, you eliciting orthostatic drop in arterial blood pressure. That's why it is a physiological help with in people with spinal cord injury. Loose all clothes, sometimes tight belt or tight shoelace in person with spinal cord injury could trigger episodes of autonomic dysreflexia. Also, search for other common causes of autonomic dysreflexia. Check urinary bladder catheter. Is person have a Foley catheter or suprapubic catheter? Is it kink, open passage of urine? If person did not catheterize for a long time, either do bladder ultrasound or just offer the emptying urinary bladder. Monitor blood pressure and heart rate after this manipulation. Sometimes just emptying the bladder could release episode of autonomic dysreflexia. If arterial blood pressure continues to be elevated when you've done all these simple procedures and it's elevated above 150 millimeters of mercury systolic, consider introduction of pharmacological agents, antihypertensive medications. But please keep in mind that antihypertensive agents that we recommend should have short-acting duration of action and start as soon as possible. That's a captopril, nifedipine, or nitro could be useful. Unfortunately, in Canada, we don't have any more nitro paste, which was a perfect previously help with these conditions. Some of your patients could come to your office with this pocket card or wallet card, which was developed by BC SCI together with consultation with colleagues from J.F. Strong Hospital. This is a common reminder and common educational card that helps sometimes people who never saw a person with spinal cord injury to recognize that person in danger due to autonomic dysreflexia. And this card is used internationally. It was developed initially in the United States, and right now we have this card in the various languages, but this card was developed here in BC. That's why we recommend our patients to keep them in pocket, because we do realize that when they're coming to emergency room sometimes, in somewhere far away from the Vancouver, in Kamloops or Kelowna, person first time meeting person with spinal cord injury, not familiar with these conditions. That's why we hope this card give at least short overview. What is a condition, how dangerous it is, and what to do.